Start today's Metro COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and Metro Coronavirus Task Force. We're joined today by Dr. James Hildreth, President and CEO of Meharry Medical College, Leland Evans, Project Manager at the Equity Alliance, and Dr. Forrest E. Harris, Sr., President of American Baptist College. Director Chief William Swan of the Office of Emergency Management at Nashville Fire Department and Dr. Michael Caldwell, Director of Public Health, are here to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning, Nashville. Yesterday, our nation's daily COVID-19 death total exceeded 1,100 for the first time since May, as coronavirus's cases have continued a 45-day resurgence across most of the United States. Meanwhile, the Northeast stands out as a region. Once the hardest hit area in our country, most states along the upper Atlantic coast from Delaware through Maine are now seeing daily case numbers below their respective peaks earlier this spring. Statewide coordinated response to conduct widespread contact tracing, testing, and implement mask ordinance were instrumental in reducing infection rates and deaths there in the Northeast. And this is true for numerous foreign countries as well. Public health experts are now warning of a distinct divide in our country between the Northeast and the rest of the United States if we do not work together to slow the spread of COVID-19. Tennessee has reported over 84,000 total cases and almost 900 deaths to date. Davidson County has had 18,807 total confirmed cases and 5,500 are currently active, with 161 deaths. Nashville's 14-day daily case average remains elevated and is currently at 363, but that is down 14 cases since Tuesday. Our transmission rate has also decreased from 1.20 to 1.08. Both metrics are below satisfactory, but are improvements. We currently have 16% of hospital floor beds available and 20% of ICU beds available, which are at or below our target of 20%. Both metrics require close observation. Now, as of this week, nearly all counties surrounding Nashville are part of a regional mask requirement created county by county, which is a significant achievement given the patchwork response that local governments are required to make in addressing the pandemic. On Tuesday, JAMA Internal Medicine, one of the world's leading peer-reviewed medical journals, published data from antibody tests drawn from 10 geographic regions across the United States. The data presents two important facts. The first is that the true number of infections is likely far greater than the reported cases, possibly 13 times higher than what has been officially reported. But this higher number is still not anywhere near enough to achieve the protection of herd immunity. The second observation is that of the late spring, very few people had the antibody levels required to fight off the virus. Now, if the former is true, if 13 times as many people are infected as we believe there are, then in Nashville alone, approximately 1 out of every 10 Nashvillians could currently be infected with the disease. Now, research also shows that between 40 and 43% of infected persons may be asymptomatic, all of which means that in a worst case extrapolation, that approximately 30,000 Nashvillians could be infected without knowing they are contagious. These numbers highlight the importance of masks and our duty to wear them in public places. We don't know how many people could be vectors, and the vectors themselves don't know it. And Nashville potentially could have a very large number of vectors. Those who do not wear masks and practice other healthy habits are endangering themselves and others with a false sense of security. We also have no guarantee that individuals cannot become sick with the illness more than once. The story of 29-year-old Carter Wright, a Nashville resident, has made national news. Mr. Wright tested positive for the coronavirus in March after developing flu-like symptoms, and he has tested positive again after falling ill during the second week of July and is suffering from long-term effects. As I stated on Tuesday, we've seen large numbers of crowds gathered in public, many of whom are frequenting restaurants that are functioning in practice as bars and are largely ignoring the very real threat of COVID-19 pandemic. We cannot allow disease deniers and others who do not have an interest in the long-term success of our city dictate the safety of our residents and the viability of our local economy. Our tourism industry is vital to Nashville's success, but it cannot exist without a healthy workforce and a healthy community. With the recommendation of the Board of Health, Metro has created a new public health order effective tomorrow that directs all bars, restaurants, and other businesses that serve alcohol to close by 10 p.m. across the county, while continuing to observe other public health protocols. Oregon Governor Kate Brown announced yesterday that restaurants and bars across their state would also close at 10 p.m. beginning this Friday, joining a growing list of states and municipalities with similar ordinances, including South Carolina, North Carolina, Florida, and our neighbors in Tennessee and over in Shelby County. It is worth noting that Oregon has less than 1/3 of the daily new cases seen in Tennessee, and a positivity rate that is just 2/3 of what we're seeing in our state. Now, this order will best serve our residents and responsible visitors. It curbs the type of unguarded, irresponsible behavior we've unfortunately seen among large gatherings, especially later in the evening, over the past several weekends. All bars, limited service restaurants, and transportainment vehicles under the Metro TLC authority will remain closed until at least July 31st, pursuant to amended Order 9. Now, if you're upset about these restrictions, it means you're paying attention. And as I've said time and time again, and as Nashville has demonstrated over the years, there's only one way out of this crisis, and it is together. There is no easy fix to a pandemic. And as I said earlier this week, if nearly 100,000 children must stay home because of the coronavirus, we must make sacrifices to improve the public health condition of our city. This global pandemic has already claimed more American lives than the First World War, and many more will be lost unless we act to protect our community. Remember, Nashville, don't share your air. If 8 out of 10 Nashvillians wear a mask, we can avoid further shutdown and fully reopen our economy without interruption. As always, you can receive a free mask by visiting the Lentz Public Health Center Monday through Friday from 9 a.m. to 3 p.m. And this morning, I want to welcome Dr. James Hildreth, President and CEO of Meharry Medical College, who's with us to provide his well-informed commentary on COVID-19 and our response to the disease. It is also my pleasure to welcome Leland Evans, Project Manager for our Fair Share Needs Assessment, conducted by the Equity Alliance, which is working closely with our office and the Metro Council's CARE Act Oversight Committee to determine the responsible and equitable distribution of federal relief funds. And finally, I want to welcome Dr. Forrest Harris, President of American Baptist College, who's with us this morning as we continue to honor the memories of two civil rights heroes with deep Nashville roots, Reverend C.T. Vivian and Congressman John Lewis. And now I'll turn it over to Dr. Alex Jahanger, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here is the latest on coronavirus in Davidson County. We now have 18,807 confirmed cases. That's 407 new cases since yesterday. There are currently 5,545 active cases, and 69% of all confirmed cases, or 13,116 residents, have recovered. Since our update on Thursday, 6 Nashvillians have died because of confirmed COVID-19. 161 Nashvillians have now died since the beginning of this crisis. The mortality rate for our city is 0.85%. Our rolling average is 363 new cases. This is actually down 10 cases per day from 1 week ago. 20% of ICU beds in our region are available, and 16% of hospital beds are available. 222 individuals are currently hospitalized in Nashville hospitals with COVID-19. Overall, more than 151,000 Nashvillians have tested for this virus. Over the last week, close to 20,000 Nashvillians have been tested, and 15% of those individuals were positive. Our transmission rate for Nashville is now 1.08. This has dropped from last week's 1.2 mark. The transmission rate needs to be under 1 to slow the virus from spreading. The doubling rate for the virus is now 28 days. This has improved 5 days since the first of the month and above our 14-day goal. Over the past month, new cases and transmission rate went up. Our hospitals are seeing more COVID-19 patients, and we have not been able to report much positive news to you. And so we have taken strong actions, mandating everyone wear face coverings, the implementation of a modified phase 2, and now a 10 p.m. closure of restaurants, dine-in services, and bars. I appreciate all that you have done during this crisis. Now, we are far from declaring victory, but we are starting to see some positive outcomes over the past week. Doubling rate has gone up. Transmission rate is starting to drop. The rolling average of new cases is stabilizing, and the mortality rate is staying stable. For these trends to continue to improve, we need your partnership and commitment. The community assessment centers are open today and every day, Monday through Friday, from 7 a.m. to 1 p.m. The 3 centers are located at the Kmart in Antioch, Meharry Medical College, and at Nissan Stadium. I want to thank the volunteers, the Meharry team, the Office of Emergency Management, and our National Guard partners who are staffing these assessment centers. They have been working in very hot weather and other extreme weather scenarios. In fact, yesterday, because of lightning and rain, there had to be a slight delay. And through it all, they have provided much needed and free testing for all people of Nashville. So far this week, they have tested 4,500 individuals, and I'm grateful for all their hard work and dedication. We all need to do our part. Stay at home as much as possible, especially if you are sick or if you're waiting to get your test results back. If you go out, wear a mask, keep your hands washed, and stay apart. If we focus and work together, then our children can go back to school. Our economy can open up more, entertainment and sports venues can open up, and most importantly, we can save lives. Thank you so much, and I'd like to introduce Dr. Hildreth.
Good morning, Nashville. First, I want to share some positive developments related to COVID-19 vaccines and research. Data has now been published on one of the vaccines that's made it into human studies. The vaccine in question was produced by scientists at Oxford, and it's being commercially developed by a company called AstraZeneca. This vaccine is actually a common cold virus that's been modified to look like COVID-19 virus. And the idea is that when this virus is introduced into humans, the immune response will include a response to COVID-19. The good news is that this vaccine was well tolerated and safe. The better news from my perspective is that this vaccine induced 2 kinds of immunity that we know are important in eliminating viruses. It induced antibodies, but it also induced a T-cell response. This vaccine will now be tested in 30,000 individuals at multiple sites around the world, including here in Nashville. The timeline for this vaccine is such that we may well know by the end of the year, perhaps even sooner than that this vaccine is in fact efficacious and should be distributed widely. And preparations are already being made to make hundreds of millions of doses of this vaccine if the FDA approves it. There's also some really exciting research happening in terms of the basic biology of the virus. Viruses like COVID-19 are essentially lipid capsules that contain proteins and other kinds of macromolecules. Some of those proteins are called structural. They're kind of like the joists and the studs in a house to maintain the structure. There are other proteins inside that are called non-structural, and they do a variety of really interesting things. One thing they do is to try to play tricks on the immune system. We now know that one of the non-structural proteins in COVID-19 actually completely shuts down protein synthesis as soon as the virus gets into the cells. And this is important because protein synthesis is critical to early immune responses to viruses. So we now know that this might be a potential target in terms of treating the virus infections. So this discovery and others like it are really exciting and give us a new way to think about how we might treat this virus. So I think that from the perspective of vaccine studies and basic science, there's a lot to be hopeful about, that we can put this pandemic behind us. Now, wearing masks has become a hot topic in the fight against COVID-19. The science is crystal clear that wearing masks can blunt the spread of the virus. The message has been delivered many times and by many messengers. And after weeks and months of debate, leaders across the country are now mandating the wearing of masks. But despite the evidence and the mandates, there are many individuals who still refuse to do so. To those individuals, I'd like to offer a slightly different perspective. Most of the individuals, including all of the rest of us, readily acknowledge and thank the healthcare heroes who put their lives on the line every day in fighting COVID-19. But actually, we're surrounded by heroes of many, many types, like the police officers who patrol our streets and keep us safe, the firefighters who rush in buildings, burning buildings to save lives. Then there are the men and women who put their lives on the lines on battlefields to give us the rights and freedoms we enjoy. And some of us seem to think that one of those rights includes the right to refuse to wear a mask. These heroes are our neighbors, and some of them are our family members. For me, it's my daughter who is on the front lines in Iraq, my brother who fought in Vietnam, and 3 of my uncles who fought in Germany and France. Some of those heroes are now living in assisted living facilities, being among the most vulnerable to COVID-19. These heroes remind us that we're currently in a war with an invisible, relentless, remorseless enemy that will continue to infect people, cause disease, and kill individuals if we don't take steps to stop it. The question is whether we're willing to do our part to win this war, as our heroes have done in other settings. And unlike the heroes that we celebrate, we're not being asked to face down bullets, bombs, or bayonets. We're not being asked to strap a 60-pound backpack on our backs and march through mosquito-infested forests or blistering deserts. We're not being asked to stay in a ward of really sick COVID-19 patients on a daily basis, putting our lives and our family lives at risk. We don't have to do any of those things to turn this war around. All we're being asked to do is to wear one of these when we're out in the public. So compared to the heroes that we celebrate, our part in winning this war is really simple and really easy. Our heroes need heroes, or as Spock would say, sometimes the needs of the few outweigh the needs of the many. And we got to decide if we're going to be the many who are concerned about the needs of the few. So let's do our part and wear masks, and by doing so, we'll be the heroes that are needed to win this war. And to some of you, let me say, in a way, that when we choose not to wear a mask, we're dishonoring those heroes who fought to give us the freedom to say we're not gonna wear a mask. We're also dishonoring the sacrifices being made on a daily basis by people in healthcare units who will take care of you whether you were wearing a mask or not. Think about it. What would happen if you showed up sick with COVID-19 and you got turned away because you didn't cooperate and wear a mask? You would think yourselves ill-used and that your rights had been abused. So let's turn that around and realize that we have a role to play in this war, and we can be heroes in it. So it's time for a new hashtag, perhaps. I am a hero because I've chosen to wear one of these to do my part in the fight against COVID-19. Think about it. So, with that, let me introduce Leland Evans from the Equity Alliance. Thank you, Nashville.
Good morning. Thank you, Mayor's Office, for allowing us to be here. The Equity Alliance is a nonprofit organization that has worked the last 4 years to gain and to organize the trust of the communities, advocating for Black and Brown communities to have a fair and just opportunity at realizing the American dream. Today, we are excited to announce the Our Fair Share community-wide initiative presented by the Equity Alliance and in partnership with community organizations and educational institutions to provide a direct line of communication to the Mayor's Office and Metro Council. This is a survey powered by the Equity Alliance, funded with federal stimulus money to help guide COVID-19 relief funding decisions for vulnerable communities. You can fill out the survey today at www.ourfairsharenash.com. It has been difficult times for all of us as Nashvillians and as Americans and as people around the world, but even more for people of color living in COVID-19 hotspots. Days after the tornado left many people homeless, then uncertainty of COVID-19 and the stressful unrest of racism, Nashville's people of color are experiencing a pandemic times 10. This initiative will ensure our city leaders receive accurate depiction of the voices and needs of people of color in Nashville during this time. We know we're stronger when we bring a collective voice for a collective impact. We're asking everyone who has been impacted by COVID-19 to complete our Fair Share survey by Friday, August 7th. The website is www.ourfairsharenash.com. This confidential survey is a collective effort by the Equity Alliance, Mayor John Cooper, and Metro Council to ensure our needs can be heard now instead of later. Before the COVID-19 pandemic, communities of color were already living off of the bare necessities. However, now it is more dire than ever that we do more. In cities like Nashville, our working class are our essential workers. Our teachers, our bus drivers, our paraprofessionals, and our hospitality workers are the ones being impacted the most. As we've seen from reports, Latino residents represent 1/3 of the COVID cases, and Black residents represent 1/3 of the death rate of COVID cases. In order to properly respond to the public health and economic crisis, the Equity Alliance needs your help and your input to ensure we get our fair share in the CARES Act federal funding. The Our Fair Share initiative will directly communicate the real needs related to COVID-19 to the decision makers so that people of color are not left behind in Nashville. We need our community's voice equitably reflected to the decision makers for COVID-19 relief funding and resources. Perhaps you or a loved one you know have gotten COVID-19, or you're an essential worker and you're not sure how to navigate through the virtual learning requirements for your school-aged children. Or you're caring for an elderly or disabled person. Maybe even you're a small business owner. We want to hear from you. Again, please go to the website at www.ourfairsharenash.com. Join me today in filling out the survey, and let's work together to ensure our families and loved ones and small businesses can recover from this pandemic. Again, we would like to thank the Mayor's Office and Metro Council for partnering with the Equity Alliance to start this initiative. Thank you.
Thank you, Mr. Evans. I'd now like to introduce Dr. Forrest Harris, President of American Baptist College.
Thank you, Mayor Cooper, for this opportunity to speak here today. Beginning today in Atlanta and Washington, D.C., Americans around the country will participate in ceremonies celebrating the life of two giants of humanitarian justice, civil rights, and human rights, the Reverend Dr. Courtney Tyndale C.T. Vivian and U.S. Congressman John Robert Lewis. We cannot account for divine providence to have nationally and internationally recognized icons of the civil rights movement, recipients of the nation's highest civilian honor, the Presidential Medal of Freedom, that their long, extraordinary public life of service began here in Nashville at American Baptist College. Here, they discovered a moral compass for justice, courageously guided them to confront the segregation culture of Nashville's lunch counters. Afterwards, the Freedom Rides, successfully integrating interstate bus travel. They marched nonviolently into the cradle of the Confederacy for the right to vote. Blooded on the front lines, jailed many times, they gave their bodies as collateral, as living sacrifices to redeem the soul of America. In the face of imminent danger, their spiritual endowments showed America the power of moral authority to achieve a more just nation. On occasions, confident that they would meet death in the cause for justice and freedom, they signed their wills. They challenged, inspired, and confronted America with simple words in their moral character: dignity, love, one humanity, equal votes, equal souls, bodies broken, yet spirit unbound, they advanced freedom. They showed us what the work of justice looks like, how to do it, and how to extend justice in the nation and world. Similar to and befitting of the prophetic courage, compassion, and love ethic amplified before them in the life of Martin Luther King Jr., they continued pursuing the goals of the beloved community. John Lewis carried the vision into the halls of the United States Congress more than 3 decades. C.T. Vivian gave voice to the vision as a justice consultant, activist, civic engager, public intellectual, and theological educator. They provide us an inspiring example of ethical service and leadership, inspiration for today's Black Lives Matter movement. Because their illustrious public service for justice began here in Nashville, telling and retelling their powerful stories belong primarily to Nashville. We cherish the memories of these gentle warriors of justice, class acts of unpretentious chivalry, profiles in courage, healers for the nation's racial animus that yet divide the country. American Baptist College's commitment is to join Nashville as a responsible steward of their legacies, advancing the mission of justice for which they gave their lives. 16 years apart in birth, dying on the same day, they leave flaming legacies, a lighted path for future generations, that they may walk in that path to achieve a better America and world. I thank God that C.T. Vivian and John Lewis trod on the soil of Nashville, on the banks of the Cumberland River, downtown lunch counters, and all across this nation. And now we honor them. We honor them because we will perpetuate their legacies by changing America forever. Finally, please join us for an American Baptist College conversation on the John Lewis documentary, Good Trouble, Sunday at 5:45 p.m. on Facebook Live, or visit our website for more information. Thank you.
Thank you, Dr. Harris. We'll now begin taking media questions. Our WebEx video feed is having some technical difficulties, so please bear with me as I read these questions out loud. From Nancy Amos at WSMV, she's asking for the mayor's reaction to calls to close all of Lower Broadway, and to Dr. Jahangir, some hospitals are reporting their COVID units are full. Can you please give details? So we'll start with Mayor Cooper.
Thank you, Nancy. Appreciate that. Sorry for the technical difficulties. The calls for further restrictions. Everything has to be on the table. We have to get our community safely to the other side of this pandemic, and we will observe and respond as required.
Nancy, I think it doesn't surprise anyone, because we've been talking about it for a few days or weeks now, that the hospitals are getting more and more full of COVID patients. As I mentioned, 222, I believe, right now. And what you hear is accurate. I know Vanderbilt, for instance, they had a fairly large size unit for COVID patients, and they've now had to staff up and open another one. Same thing with St. Thomas, and I suspect the HCA system as well. This is why it's very critical for us to flatten the curve. It's also very critical for us. That's why Mayor Cooper and I, working with Mayor Cooper, have really been pushing and working with the state and with our hospital systems to increase our ability to have more capacity. As I mentioned this morning, 20% of our ICU beds and I believe 16% of our hospital beds are still available, but we have to be very careful. COVID patients, our hospitalization average around 12 days, where pneumonia is 5 days. So if you're in the hospital with COVID, you actually stay there longer. So very important to be very diligent, and we'll continue watching that for you. So thank you.
From Julia Palazzo at WKRN. The first question, the White House told 11 cities in a private phone call, including Nashville, to take aggressive action to respond to COVID-19. Was anyone from Nashville invited to be on the phone call? Julia, I'll if you don't mind, I'll answer this, and I'll tell you what we told several media outlets yesterday. This is a weekly phone call, one that we've participated in many times in the past. Yesterday, as you can imagine, most of the mayor's office staff was busy engaged in more pressing matters directly related to Metro's COVID-19 response. So we did not participate in yesterday's phone call, but I'll tell you what I told the other media outlets is that this is not new information. This is old information that Mayor Cooper and others in these press briefings have repeated several times over the past month, that case numbers had gone up, that the positivity rate had been increasing, and just as we have implemented aggressive measures, including a modified phase 2, including a mask ordinance. We are starting to see some of those numbers slightly improve now that information from the White House is coming out, again, based on old information. Your second question is a reaction to the petition to shut down Lower Broadway that has more than 5,000 signatures. I believe Mayor Cooper has just addressed that. And then your third question, we had a viewer ask about rental assistance programs in Davidson County. With unemployment benefits being taken away, she's worried about making payments, and you're referring to that viewer. Mayor Cooper, if you'd like to address the third question.
The question on rental assistance, I really would urge your viewer to be the first respondent to the Fair Share Needs Assessment being conducted by the Equity Alliance, so that their need can be clearly expressed and that we can seek to ameliorate it and then also advocate for help from our state and federal partners.
From Harriet Wallace. Tourists congregating downtown have been noted as a contributing factor to the spike in cases. What is being done beyond a note on the Nashville Convention and Visitors Bureau to hold them and Butch Spiriton accountable? He's touting a message to visitors, we're good to go, but it's quite the opposite. Mayor Cooper.
Well, everybody in Nashville is allowed to hope that this is over, wanted it to be over, and to be ready to have a full and complete recovery. It is devastating to understand that, in fact, we have relapsed, and we're, as with most of the country, and many, many other states, are not where we wanted to be at the end of July. And I do think that currently you're seeing a consistent response from so much of our business community to welcome the tougher measures in order to get us back on track, but recognizing that it is not easy and then there is some sacrifice. The hard thing for your viewers, 80% masks and help us, but we need 80% compliance. That needs to come from a unified message, as you flagged from your question, from everybody, from both business operators, from the tourist industry, as well as all of us. 80% is a high threshold, and mixed messages on the need for masks, whether they're coming from the national level or a local level, is simply not helpful. And 80% is a high bar where you can't cite your way to an 80%. You can cite your way and improve it by a couple of percent, which we are certainly prepared to do. But your media outlet needs to carry the message that we're all in this together and we have a basic standard that we need to follow. And if we do, we have now good examples from the Northeast and from other countries that you can flatten the curve, and we have to do that. And no relaxing is allowed, and no mixed messages are allowed. And Nashville has been on this now for some time, and we are thrilled to now have effectively a regional mask ordinance for the first time coming into place really just in the last few days. Let's give that some time to help that work, but it's only going to work with this kind of 80% compliance, which is just a huge number for America. We have to learn how to work together. All of us have to learn how to work together, and we cannot, again, really sponsor a mixed message.
Excuse me. From Chris Davis at News Channel 5, what is the likelihood of children under 12 getting the virus? Given that no more than 25 people should gather at a time, is it a good idea for private schools in Nashville to be allowed to return in a few weeks? Dr. Jahangir.
Thank you. Regarding your first question, what's the likelihood of someone under 12 getting the virus? people under 12 can get this virus. What we are learning about this virus, perhaps children, especially younger children, maybe have less ability to infect, maybe they shed less virus, less viral load, but they can still get the virus. We've seen that. There's an inflammatory response in children that we're starting to see, that's a vasculitis. We've talked about that before. But hopefully it appears, especially in the younger kids, that the response definitely is maybe not as bad as in older people, but don't fall under the misconception that children cannot get this virus and cannot spread it to others. The second question regarding private schools, I think that when we, again, as one of the first people in the country, first groups to put the school plan out, there was a very detailed reopening plan. And as part of that plan, schools, private, parochial, charter, and metro public schools all came together and really came up with best practices based on the medical guidance. Part of that guidance is classrooms will, when able, socially distance. Children will wear masks or have partitions. There will be, class won't be like what we're usually used to. There's not going to be big assemblies. There's not going to be field trips. So I think schools have really given this a lot of thought as they're planning the reopening process. The 25 restrictions typically for a house party and other things. Places where there is able to have enforcement, and by enforcement I mean in this scenario a teacher that can instruct the children to stay certain ways. Their desk can be a certain way. Have lunch a certain way. That's a little bit of a different scenario. So I have confidence that each context of schools are taking into consideration the best interests of their children, as well as the staff and faculty, and their best decision will be made based on that evidence. Thank you.
Our final question today is from Josh Breslow at WKRN. It's for Dr. Caldwell. The 36-year-old man who passed away and is listed as a probable COVID-19 death, can you say what his underlying conditions were?
No, we're not able to comment on that.
Those are all the questions we have this morning. I'd like to thank Dr. James Hildreth, Leland Evans, and Dr. Forrest Harris for joining us today. The next scheduled Metro COVID-19 press briefing will air on Tuesday, July 28th at 9:30 a.m. Thank you for joining us. This concludes today's event.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.